Welcome to Module 5, Maintaining Eligibility. Topics that we will cover in this training module include Washington Apple Health Medicaid renewals, post-eligibility review, or PER, program integrity, Washington Apple Health Medicaid suspension, and resources. We will start by going over Washington Apple Health Medicaid renewals. Apple Health renewals. Renewal of Apple Health eligibility is required at least every 12 months, except for individuals turning 65 within the next 12 months. They will need to apply for a Classic Medicaid by the month they turn 65. Those receiving Alien Emergency Medical or AEM coverage are certified for a specific period of time that only covers the emergency. And for those who are on an Apple Health medically needy spend down, in which a new application is required at the end of a 3 or 6 month base period. Apple Health renewals. Washington Health Plan Finder will attempt to auto-renew the individual's coverage 60 days prior to the end of the certification period. Individuals are automatically renewed for a new certification period when the electronic data sources show an individual's information, such as their Social Security number or household income, is reasonably compatible. Individuals must renew manually or take action to update their application when the electronic data sources show an individual's information may not be reasonably compatible. Apple Health Auto-Renewal. When an application is determined eligible for auto-renewal, the individual will be renewed for a new certification period, receive a pre-populated notification that summarizes their account, household composition, tax filing status, and other information related to the application, and review the notification for incorrect information and report changes online, over the phone, or by returning the signed form via mail or fax. If there are no changes that need to be made, then no action is required by the client. Apple Health Auto Renewal. The notification called Washington Apple Health Renewal Review Only, which is shown here, informs the individual that they have been auto-renewed and will continue to receive Apple Health coverage. Apple Health Manual Renewal. When an application is determined ineligible for auto-renewal, the individual will receive a pre-populated application called Washington Apple Health Renewal Action Required that summarizes their account, household composition, tax filing status, and other information related to the application. The individual also must take action to renew coverage. To be considered for Apple Health coverage beyond the current certification period, a signed renewal form must be submitted. Individuals may submit their renewal online at wahealthplanfinder.org and select Update Application and Renew Coverage, or over the phone, or by returning the signed form via mail or fax. Please note, if an individual is determined over income for Apple Health during the renewal period, they will be screened for a qualified health plan with or without tax credits. The individual will receive more information about this process by notice. As mentioned on the previous slide, here is an example of the Washington Apple Health Renewal Action Required letter. This letter includes a deadline and options for the client to complete the renewal process. Additionally, a pre-populated application with current account information is attached to this letter. The form provides spaces for individuals to submit updated information by mail or fax. Here are some additional sample pages from the pre-populated application attached to the renewal form. Renewal Timeframe. When can an individual renew coverage? An individual can renew coverage 60 days prior to the end of their certification period, or up to 90 days after the coverage has ended. If an eligible individual submits a completed renewal within 90 days after their coverage closed, Apple Health will be restored without a gap in coverage. If a renewal is not received, a termination notice is sent 20 days before the end of the certification period. Renewals at age 19. Tax dependents of the primary applicant will be approved or renewed on Apple Health regardless of age or relationship, as long as they meet all other eligibility requirements. Individuals who are 19 years old or older and are not the spouse or tax dependent of the primary applicant must still apply on their own. Adult tax dependents have the option to apply on their own if they choose. Renewals at age 19. The month before a tax dependent turns 19, the system tries to auto-renew Apple Health coverage. When eligible for ongoing Apple Health, the tax dependent's coverage will change to the relevant program based on income and other circumstances, and for most it will be Apple Health for adults. If the application cannot be auto-renewed, the household must manually renew it. Renewals at age 65. Individuals who are active on Apple Health for adults and turning 65 will receive the Washington Apple Health Renewal Action Required notice 60 days prior to their birthday month. Individuals who are 65 and older can apply for Apple Health Classic Medicaid coverage online through washingtonconnection.org or by completing a paper application. For more information, please visit the HCA link shown in this slide. Apple Health Renewal. Renewals for Magi Apple Health can be completed online at wahealthplanfinder.org by calling the Washington Health Plan Finder Customer Service Center at 1-855-923-4633 or by returning the signed and completed paper form via mail or fax. Post-eligibility review. Next up is an overview of the post-eligibility PER process. PER background. What is a post-eligibility review PER? PER is the verification process completed by HCA staff when the attestation of income is not compatible with information obtained through cross-matches, and the cross-match shows the client may not be eligible. Eligibility for Magi-based Apple Health is based on self-attestation, which is typically accepted at the time of application or renewal. PER background. Income is described as not reasonably compatible with federal and state cross-matches when the income an individual attested to is below the Apple Health standard, but the data sources indicate the income is above the Apple Health standard, and the data sources are not available. Incompatibility. Take a moment to review this slide. An individual's attestation is accepted at the time of application or renewal. The information in the application is cross-matched with data sources. This diagram shows that process, which determines whether a PER will be needed based on the cross-match results. For those with cross-match results above the standard, a post-eligibility review will be required. Those with cross-match results below the standard will not have a post-eligibility review. For those where data sources come back as unavailable, a post-eligibility review will be required. We do not conduct a PER for those individuals who are not reasonably compatible only because they received SNAP or cash assistance. Incompatibility. Continuing from the previous slide, when an individual attests to being over income for Apple Health, the system determines eligibility for a qualified health plan with or without tax credits. PER scenario. Let's apply what we have learned to a scenario. Scenario 1. Rose completes her Apple Health renewal and attests her income is $500 a month from her job, but the cross-match with Employment Security Department, ESD, shows that it is $1,200 a month. Will a PER be needed? No PER is needed because the cross-match completed with the data sources finds the income is still below the Apple Health income standard. Scenario 2. Jake reports that his income is $1,200 a month from his job, but the Employment Security Department cross-match shows that his income may be $1,850 a month. Will a PER be needed? A PER is needed because the cross-match shows Jake's income may be above the Apple Health income standards. Verification of income is requested during the PER. PER process. During a PER, HCA staff check third-party sources prior to requesting verification. Third-party sources may include the Employment Security Department or other sources such as the work number, also known as Equifax or TOLCS. When HCA is unable to verify income with third-party sources, a letter is sent to the primary applicant requesting at least 60 days of income verification. This letter is sent to only the primary applicant and any authorized representative who have permission to receive letters on the applicant's behalf. This is an example of a Washington Apple Health information request letter sent to an individual. The letter gives examples of acceptable forms of verification an individual can submit depending on the income type. The letter includes the income request, types of verification, the submission deadline, and contact information. All letters can be viewed in the Washington Health Plan Finder Message Center the day after they are sent. PER process. Individuals are given 15 days to provide the requested information. Individuals can provide this information by email, fax, mail, or by uploading these documents to their document center in the Washington Health Plan Finder application. HCA may grant additional time upon request. PER process. After the due date, HCA eligibility staff check the document systems for the requested proof of income and use the information provided to determine eligibility. If verification is not provided and staff still cannot verify the attestation, eligibility is based on all information available. This may mean an individual could be eligible for a different program, including a premium-based program. If the requested information is not provided or the verified income is over the standard, Apple Health coverage could terminate. Even if someone is over income, they still need to provide proof of income so eligibility for a qualified health plan can be determined. Individuals who do not respond are not eligible for other healthcare coverage. Here is an example of a termination letter sent to an individual when verification has not been provided and staff are unable to verify the individual's attested income. The letter includes what was requested, the date it was requested, and the date it was due. All letters can be viewed in the Washington Health Plan Finder Message Center the day after they are sent. Reapplying following a PER. After a PER is completed, the coverage is closed. Individuals have the option to reapply for Apple Health. However, self-attestation may not be accepted. When income is not automatically verified through data sources, coverage will be placed in a pending status and manual verification will need to be completed. Reapplying following a PER. What does pending status mean? A pending status means that coverage is not approved or denied, but verification is needed before eligibility is determined. When individuals are in pending status, a letter is sent through the Washington Health Plan Finder requesting information to be submitted within 15 days. HCA may grant more time upon request. HCA eligibility staff will process the pending application after the due date. As we mentioned previously, individuals can submit information via email, fax, mail, or online through Washington Health Plan Finder. This is an example of a letter requesting information following reapplication for Apple Health. The table displays what is needed for verification purposes. This is the second page of that letter that is requesting information following reapplication for Apple Health. It provides examples of the different types of verifications an individual can submit. Program integrity. Program integrity. Insurance fraud is intentional underreporting of income to qualify for insurance coverage. This may result in severe penalties for application assisters, the provider, and the applicant. The penalties can include, but are not limited to, loss of coverage, provider referral to the Office of Program Integrity, termination of privileged user access and Washington Health Plan Finder, and criminal prosecution under Washington state law. Reporting suspected fraud. If you suspect that an applicant, navigator, or application assister is being less than forthcoming when reporting circumstances or income, protect yourself and report any suspected fraud. If you have any questions or concerns or would like to report any suspected fraud, please contact the Healthcare Authority for Washington Apple Health at wah-eligibilityfraud@hca.wa.gov or the Health Benefit Exchange for Qualified Health Plans at compliance@wahbexchange.org. Apple Health Medicaid suspension. Next up, an overview on Apple Health Medicaid suspension. Suspension overview. What does it mean to suspend Apple Health? Suspension means that an individual on Apple Health has had their full scope healthcare coverage reduced while institutionalized. When the individual becomes incarcerated, their coverage is suspended, limiting their coverage to cover inpatient hospitalization only. Once the individual is released from incarceration, their healthcare coverage returns to full scope. This is all done in the background without having the individual's healthcare coverage come to a complete stop and without having to go through the process of reapplying to have their healthcare coverage reinstated. Studies have shown that suspending coverage for individuals who are incarcerated rather than terminating their coverage provides stability of care and helps to promote a smooth transition into the community. For those individuals who apply for Apple Health while incarcerated, the system will suspend coverage overnight, and once released, their coverage will return to full scope. Applying for Apple Health. Justice-involved individuals ages 19 to 64 who are uninsured upon incarceration can be enrolled online at wahealthplanfinder.org. Individuals eligible for Medicare must apply through washingtonconnection.org. Correctional facilities can apply for Apple Health on behalf of a justice-involved individuals in their facility. For more information, see Washington Administrative Code 182-503-0010. Resources. For more resources and training materials regarding Apple Health Medicaid and the use of Health Plan Finder, please visit the Healthcare Authority Training and Education webpage at the link shown on this slide. For additional training on Apple Health Medicaid suspension, visit our Medicaid suspension webpage. For community partners, Healthcare Authority has made available a team of eligibility policy representatives to provide assistance for questions regarding Medicaid eligibility and assistance with Washington Apple Health applications in Washington Health Plan Finder. These representatives serve specific counties. For more information about the Washington Health Benefit Exchange, please visit wahbexchange.org. Congratulations! You have completed Module 5 of the HCA Community-Based Training. Please continue on to Module 6 of the 7-module HCA Community-Based Training. Thank you.